You know how Wolverine, the superhero, can get shot or cut and his body just zips back together instantly? Well, I have bad news. You aren't Wolverine. But here's the good news. Your body used to heal like that. Remember when you were 7 years old, you'd scrape your knee and 3 days later it was gone? Now you sleep on your shoulder wrong on Tuesday and it still hurts on Friday, 3 months later. Why did that stop happening? It's not just getting older. It's because the signaling system, the text message your brain sends to the injury to say, fix this, has gone quiet. Today, I'm going to show you how to turn that signal back on. It's called the Wolverine Stack, and it uses two peptides, BPC-157 and TB-500. Now, let's start with the heavy hitter, BPC-157. BPC stands for Body Protection Compound. Who doesn't want that? This isn't some synthetic drug made in a lab to trick your body. It is actually derived from protein in your own stomach gastric juices. Think about it. Your stomach contains acid strong enough to dissolve a steak. So why doesn't it dissolve the stomach itself? Because the lining is constantly regenerating. It heals incredibly fast. BPC-157 takes the same super healing instruction and applies it to other parts of your body, such as tendons, ligaments, the lining of the gut, like for IBS and leaky gut, and just old nagging injuries that you've been struggling with. Think of BPC-157 as the construction foreman. You have an injury, say a rotator cuff tear or a bad knee. The workers, your cells, are there, but they're a little confused. They've gotten old. They're slow. They're just taking a break. BPC-157 walks into the job site with a megaphone and screams, "Hey, get back to work. We need to get some more blood vessels here. We need to get collagen there. Move." It literally promotes angiogenesis, the formation of new blood vessels, which brings fresh blood and nutrients to the injury. That's how you heal. Now let's talk about its partner, TB-500. This is the peptide version of thymosin beta-4. If BPC is the foreman shouting orders at the specific job site, then TB-500 is the logistics manager for the whole body. TB-500 is systemic. It travels through your body looking for inflammation. It does two major things. It naturally is anti-inflammatory. It calms down the angry, red, swollen tissues so healing can actually begin. And two, it's flexible. It keeps tissues soft and pliable. This is crucial. When we age, we get stiff. That's fibrosis. It's the enemy. It's scar tissue. TB-500 helps prevent the scar tissue from hardening, keeping your muscles and tendons flexible. So when you combine them, BPC builds the new road and TB-500 clears the traffic jam so the trucks can get through. That's what we call the Wolverine Stack. So I know what you're thinking. Tina, this sounds great, but do I have to inject it? Yes, but look at this. This is an insulin needle. It's super tiny, like a mosquito bite. It's barely the width of a hair. Most patients, men and women, are a little scared of needles until they do this one once. It goes into the subcutaneous fat, usually in just the belly fat or the thigh. You don't feel it. It's not going into a vein. It's not going into a muscle. It's just under the skin. And is it safe? BPC-157 has phenomenal safety profile. Because it's mimicking a natural body protein, side effects are incredibly rare. However, quality matters. You can buy cheap peptides online, often shipped here from China, and they're not going to get you the results you want and may even cause side effects. You have no idea what's actually in there, like heavy metals, bacteria, fillers, and they haven't been tested for purity. If you're going to use peptides, please work with a practitioner that you trust and that knows your medical history. So, who is this for? It is for guys trying to build muscle, absolutely. Men love this stack because it allows for higher volume training. When your body is recovering faster, you can safely do more reps. More reps equal more muscle growth faster. You can keep training hard without the inflammation slowing you down. But honestly, it's for everyone else too. It's for the woman who wants to play tennis, but her elbow is killing her. It's for the guy who can't lift his grandkids because his back flares up. It's for anyone recovering from a surgery or injury who wants to cut their healing time in half. We usually run a protocol for 8 to 12 weeks. We cycle it. You don't stay on this forever. We use it to fix a problem so you get back to 100%, and then we stop. Sometimes after this initial cycle, we'll do a short 2 to 4 week cycle, just to keep recovery up or with specific injuries as needed. You don't have to live with the chronic pain just because you had another birthday. Your body still knows how to heal. It just needs a reminder. If you're dealing with an old injury, a new surgery, slow recovery, or just nagging joint pain, let's see if Wolverine Protocol is right for you. Go to silklife.com and book a consultation. And before you go, if you're feeling great physically, but your brain feels like mush, you need to watch this video next. It's all about brain fog and why your hormones might be to blame. I'm Tina Jacobs, PAC and founder of Silk Life Medical. Let's get you healed up.